Can I have a motion to accept the January 18th meeting minutes as recorded? Have a second? And
You're on this committee.
then I think we can go to presentations. First up, we have Tyler Kellogg to present our mental health videos that we put together.
Thank you so much, guys. Can I just sit right here?
Yeah.
Okay. So thank you so much for having me, everyone. I really appreciate it. I'm going to take a couple minutes here today to go over our most recent videos that we've made for the county. If you aren't aware, thank you. If you aren't aware, this is our third project that my partner Jordan and I have shot for the county. The first was a mask and social distancing video in December of 2020, right when the peak was really starting to swell up here. And our second was a vaccine project that we did last spring. So what we do when we create videos is help to tell people's stories. And it sounds complex and it sounds easy all at the same time. Ultimately, you're just trying to ask people questions that give them the opportunity to give you genuine answers. And when we're creating these videos, we're trying to create them for different pieces of the public. Obviously, with this current video, we've been trying to deal with some mental health issues, not just suicide, but grander mental health issues in the county. And so we really wanted to get a diverse crew of people in this. So we did 6 different interviews. We had Anna Platts, who was just terrific. You'll see one of her videos in a little bit. John Waterhouse, Kimberly Kavanaugh, Aaron Monnet, and Alex Barrett from Beaver River. And we had Lynette and Joe Bush, who actually did an interview with us as well.
Joe Bush Encore.
Joe Bush Encore. If people aren't aware, our most successful video was actually with Joe Bush last spring. And that had just shy of 50,000 interactions just on the county's Facebook page alone. But I'll get to that in a second here. So this project, we had 3 focuses. We wanted to convey that you are not alone, that there are resources available in this county, and that if you're struggling, it can get better. It seems, again, very simple, but if you're going through a mental health crisis, these can seem like inachievable and inaccessible messages. So our project, just to give you a quick overview of what we've done here historically, in the course of these 3 projects, we've conducted 20 interviews with people from Lewis County. 16 of those videos were for Facebook, and 10 of them have been released so far. 6 are being delivered today. And with those 10 that have been released so far, we've had 89,400 individual interactions with those videos. For a county of 27,000, I would say that's not too shabby. Joe Bush's was your most popular video, and that had a play rate of 24,400 minutes of actual video being watched. So I'm always blown away by that number, just that people would sit and consume just videos in general, but that video specifically. And what we found in our 3 projects here is that the traits for the best reception in the community are a lifelong resident who is a respected member of the community, who has a respected societal role, specifically veterans, paramedics, et cetera, et cetera. And beyond that, we need them to seem honest, which again, all of these people are being honest, but conveying that in video can be very complex sometimes. So I'm going to start with Anna's video. Everyone here knows Anna. She's so terrific. And when we sat down with her, she was our first interview, and we filmed for just shy of 40 minutes with her. And as soon as she left, my partner Jordan and I said to each other, we could stop right now. She crushed it. She was so empathetic. She was so caring. And she spoke very honestly about her own past issues with mental health and how she sought help and how that has inspired her to create this better system in the county for everyone else. We have 4 videos of Anna that are being delivered today, all with different messages. Some specifically talk about suicide. Some talk about mental health in general. And beyond that, they're all talking about how we need to be there for each other and that we as community members are the safety net that holds each other accountable and keeps each other safe. So let's play this first one here. Let's see, just play button. you have the volume over there?
Yeah, it'll start.
My name is Anna Fox. I am the Deputy Director of Lewis County Public Health. I also serve as the chairperson of the Lewis County Suicide Prevention Coalition and the Lewis County Post-Vention Team, also known as the Lewis County Traumatic Loss Team. I quickly became very passionate about the mental health field, probably because of my personal experience. When I was in graduate school at Springfield, I was really struggling significantly. I remember the day vividly that I decided to get help. I was going to the health center to get my allergy shot like I always did. And one day instead of turning left to go to the health center, I turned right to go to the counseling office because I didn't know what to do. I was very lonely, I was isolated, and school wasn't going as planned. I didn't know how to keep going on like that. I knew I couldn't, so I knew I needed to do something. I had a phenomenal experience with a counselor at Springfield. When I came home, decided not to go back to Springfield. I thought maybe I could get by without help anymore, but I was wrong. I talked with my primary care provider about what was going on. He recommended a therapist to me, and actually, between my doctor and my therapist, I was diagnosed with ADHD and continued to take medication for it regularly and participate in therapy regularly, and that experience has been life-changing. I remember saying, I don't know how I could have survived that year, and I think now working in this field, I know what that means, and how sad and upset and depressed I was. And I'm so grateful that those connections were made, that I had those trusted people in my life that helped me get the care that I needed.
So that's Anna's first video, and honestly, it was a really difficult choice of which of her 4 videos to play today, because each one of them are different, and they're all equally impactful. I have probably watched her 4 videos a total of 120 times at this point. I know the entire dialogue in that because I cut it down from 45 minutes. And I will tell you, that woman is a gem, and she should be celebrated. So that's a personal note. The next person that we had is John Waterhouse, who equally blew me away. I didn't know what John's background was. I didn't know much about it. I knew that Pat had connected me with him, and in his reply to me, he said, "Be at my house at 9:15 a.m. I will see you then." And that was all I knew, which as an interviewer is both exhilarating and terrifying. But John is the exact demographic that this project is striving to connect with. Statistically speaking, it is retired men who are at the highest risk of suicide in this county. And I believe, I could only see the data up to 2018, but I believe that you're second or third per capita in the state as far as the county goes for suicide. Every suicide is a profound loss, but John talks specifically about, well, I'll let him tell.
I remember walking along the Black River and looking at the river, and all of a sudden I had this feeling in my brain that was not helpful. And I guess you can put 2 and 2 together, but I was looking at the river and I was thinking about myself. And I was thinking, where does that come from? Why would I have these
That's as far as it goes, unfortunately.
thoughts at that particular moment, and what should I do about it? Subsequently, with a talk with a doctor in Lewis County, I did go on antidepressant medication. I felt myself again, but it was a very brief, punctuated moment of internal crisis that I've had no history. Suicide has always been a word that brings fear to everybody that's involved in the situation. But it's something that you have to address every single time. You can't leave that word dangling out there and not put some energy into it. if something's wrong in your life and you don't feel right, and maybe only you know that, please find somebody to help. Seek out mental health services. Find somebody that has your ear, somebody that you confide in, and talk to them about it. And get moving along the path of getting better. It's so important. And you will get better. You just need to make those connections with folks that can help you. And in Lewis County, there are plenty of opportunities for that to happen. Lewis County has had a history of associations with mental health providers that help people in the county. It's extremely important. You heard it. Find somebody to help. My name is John Waterhouse. I'm a washed-up educator. I love teaching. I love now being a parent. I love being a grandparent. And I'm hoping that this interview will spur people on to do the right thing and get some help.
So you'll notice that at the end of this video, we put the crisis lines directly. And I wanted to say thank you to Anna for making the specific link that was lewiscounty.org/help, because it's just easier than a big 90-mile long, incapable to type, hyperlink. So that directs you right to all the county's mental health services. And so anytime we specifically mention suicide, we put the crisis numbers there, because the idea is that if anyone is suicidal and is consuming this, we want to give them resources right off the bat to be able to connect into. John's is incredibly powerful. I've, again, watched that like 50 times, and it takes every ounce of self-restraint I have to not tear up when I watch it, because he's so honest. And it's a tough thing to be vulnerable on camera talking about mental health. But all of the people that we interviewed in the county did fine. Which just, again, Pat, thank you for connecting me with all of these people, because these are your neighbors. And this is who we want to be hearing from. So the third and final video I have to share with you today in this meeting is Kim Kavanaugh's. And Kim is a gem. She has dealt with some pretty serious mental health issues herself. And beyond that, she has put her efforts into helping her neighbors and her community as a peer advocate and a peer resource. And so I'll let Kim talk for herself here.
My name is Kimberly Ann Kavanaugh, and I've been living here for almost 30 years. I am a trauma survivor, I'm a mother, I'm a writer, and I love this area because I believe it's a place where people really do care. Being a mental health advocate or a peer advocate means you help people do things that they can't do themselves. They just need a little encouragement sometimes. Maybe they just need somebody to believe in them so they can do the work that well. I've written Haunting Lucidity is the one I'm the most proud of because it was my first book. I was writing it in a dark time when I needed to write it. I'm really proud of that book because it took a lot of courage for me to publish that book. I wrote it for me first, and then it inspired other people to say the same. And that, to me, is the best thing that can happen from struggling with trauma. Is you go through it, and then you inadvertently inspire somebody else. I would say everybody has problems with mental health because we all have stress. Sometimes it's good stress, and sometimes it's bad stress. But everybody has stress. Nobody knows you're struggling unless you say something. You'll find people who reach out and be visible, reach out for that help when you need it. Because there's a lot of people that do care. If somebody came to me with mental health issues for the first time, I would just listen. Just reaching out and listening is probably the best thing to do to help another person. NERCO is a Disability and Rights Resource Center. Stands for Northern Regional Center for Independent Living. I am so proud of that agency because of the work that they do every day. I not only work there, but they have reached out to me. They have treated me back to health and wellness. And everything that I learned there has taught me life skills that I can use forever. The Community Health Hero Award I was nominated when I worked for NERCO, and my calling has also been working with others with mental health and anger management. And I've kind of been the poster child for bipolar and getting the word out there that let's end the stigma, you know. So I was recognized as a hero. I'm the type of person that you tell me I can't do something, I'm gonna prove you wrong. When you fall, you dust yourself off, and pick yourself up and do it again. If you're struggling, just know that there are people that care. I care very deeply about people, and I'm not the only one. There are so many people that care about you. Let's heal together. Reach out, don't be afraid.
So again, you can see that there's a big variation between all three of those videos, but they're all essentially pushing the same message, which is there's access to care here. There are people that care about you and that it can get better. I'd encourage any of you to watch these on a computer later on when they're posted too, because you'll get to see them in full 4K and with good volume and everything as well. But so whenever we do these projects, we film about twice as much as we need. Because when you're in editing, you want to be able to work down. I use the analogy of an ice sculpture. You start with a single block and you chip away. You can't add back to it. So when we do these projects, we always try to film more interviews than we need on the grounds that if we have a technical issue or if someone isn't well spoken or something, we don't get stuck. And so we actually have 3 more interviews that we've done that we can cut more videos from if you'd like. The first I'm going to highlight here is Lynette and Joe Bush. Lynette lost her brother to suicide 9 years ago. And I will tell you very candidly that I cried during this interview because it was so moving that she was so honest and so vulnerable. And on multiple occasions, I said, Lynette, we can stop if you want. She said, no, this is what people need to see because this has been a decade and I'm still living with this. And she was incredibly forthright and caring. So if we are to cut a video with that, that will be some serious work because her story deserves a compassionate editor because she was so vulnerable with us. The next is Erin Monette, who did one of our first videos. She was terrific. She and her son did a video for us, and they were awesome. She and her partner, Alex Barrett, over at Beaver River, they're both the guidance counselors, middle school and high school. We did about 45 minutes with them total, and they were terrific. The reason that we chose not to edit them this time around is that Anna just touched all bases, and hers was about a 45-minute interview, which in editing terms, a minute of video editing tends to take about 20 hours. So today I've showed you about 6 minutes. You have total about 15 minutes. And so we've got a solid 150 hours of editing, just editing in this project so far. So I just always want to kind of hit on that because people don't understand the work that goes into creating an end product. It's easy to see something. I intended to put a screenshot here of my editing bay with the thousands of cuts in it. And then, oh, okay. So at any rate, we have those 3 videos. If you want to do more, what can we do next? Our second commercial, or our second video series, we ended up doing some commercials for WWNY. I'm not entirely sure what the logistics of that are, but I know they have PSA slots for government messages. That might be something to look at. Any of these that you've seen and the other 3 that you haven't can be cut down into 30 or 60-second slots. And actually, just quick fast, I was in Potsdam doing a photo gig. I was out at a restaurant with my wife and they had a TV on. I looked up and saw one of the commercials playing. And I thought, St. Lawrence County and Jefferson County are getting all the benefits of this, and they're putting no coin forward. So from their citizens to you, thank you. But we've got plenty of cuts we can do for that. We could very easily cut 7 to 10 more long form videos like this from the interviews you've already seen and the interviews you haven't. And beyond that, if you want, we can work with you to create a grander plan for what your public communications are around this topic, because In our emails that we've gone back and forth on, there's a lot of ways that you can leverage this with community events or specific things you have going on to really get the biggest bang for your buck. So I just laid out 3 options here for you guys. We can cut 3 commercials and they can be ready within 2 or 3 weeks, just in time for March Madness to come out. That can all be around the videos that you've already seen here. And that would be about $1,800 or $600 a video. You can do a 3-cut commercial and 4 more videos for Facebook. And again, if you roll these out once a week, that will put you into the middle of April, that you can be curating these conversations. And I should have noted this earlier, but I didn't. The public health Facebook page does a tremendous job in this county of interacting with people that comment on their statuses. And of the 50,000 views that Joe Bush has got, over half were from people sharing that. So they weren't people that were already following your Facebook page. They were people that were on the outside. So every time you get people to share these, you're bringing in new people and you're controlling the conversation that you're having. So it gives you a good opportunity to kind of get that information to them. So 3 more commercials, 4 more videos would be around $4,000 or $571 a video. And again, those can stagger out if you want them. And then the final option is what I would call a full media campaign, which is literally cutting all of the videos that we have, all the interviews that we have, and that would end up between 12 and 15 videos. And you could hypothetically release a video every week, starting this week through Memorial Day. And again, you're trying to build this conversation up in the community, and so that's a pretty decent way to do that. And so I had that priced out at $6,500 for 12 videos or $7,200 for 15 videos. And again, these are just plans. You can always tweak things, change things, whatever you want. But I guess that kind of concludes my little piece here. I'll just end by saying that I am immensely grateful that this board does these difficult things for the community. I know that not everyone has been jazzed about the last couple of years that we've been living in. And I've watched you both close and from afar. And I think you've done a really tremendous job of keeping the citizens and their health and their safety at the core of your heart and the core of your mind. So from Jordan and I, thank you all so much. And thank you for letting me do what felt like a high school presentation for you in your chambers. So, is there any questions or?
Oh, I'm sure.
So we set one of our goals for 2022 that we talked about last month was, to have a broader conversation about this, utilize this asset of the videos in some way. We left it pretty open-ended. So keep that in mind that that's one of the things we wanted to achieve this year.
I just want Pat, Crystal, what do you guys think? You guys are the experts and do you think that these can have a place in the discussion?
I think, given the quality of not only those that chose to share the gift that they gave to the community, I really see it as a gift. And to allow themselves to be honest, sincere, but offer somebody a helping hand, whether they run into them or not. And I think that what I know of Lewis County since coming here a few years ago, it's very, very important that Lewis County sees Lewis County. That is, if you don't have that, you're probably not going to get as much movement on it. And then by the selection of people that participated in this, you really offer a wide variety of backgrounds that just about everybody can relate to, whether it be their gender, what they do, whether they're retired, male or female. I think it really kind of gives you an opportunity to meet as many people as possible with this. And I think that we have a lot of opportunities to really, what we're trying to do is start a conversation, whether that be somebody that doesn't understand it, doesn't know what it is, to somebody that really needs help and doesn't know where to go. It's done in a really non-threatening manner. Just the whole tone is calm. It's like, this is okay, and this is what I did, and it can help you too.
I'll just give you a piece of insight on that too, Pat. You know, we've done interviews with 20 people, and I probably have at this point 110 minutes of people talking about how much they love living here. I mean that legitimately. It is impossible to have someone say something negative about this community, this home. And so as you kind of look forward, you know, beyond this project, everything that we've done so far has been reactive to problems that we have currently. But I think you stand as a county in a really great spot to get people to be proactive in the sense that you have so many people that want to talk about how much they love living here. And I think as soon as we can start to shift your collective dialogue to what's awesome here versus what we're just trying to fix, you'll start to see some serious gains on that too. So we always try to fit at least one, I've lived here my whole life, or I can't wait for the fair. Of the 20 people, 16 mentioned the fair. So have that data point, it's yours, but.
Lisa, can I just
Yeah,
chime in? So I echo everything that has already been said, and I just want to mention that at OFA, we just got our needs assessment data back from JCC. And I think it's important to note that even among people ages 60 and over, the rates, there's a massive increase in people reporting getting their information on social media. So even among people over 60, we went from, I think it was 38% of people saying they get the majority of their information on social media to 67%. From our 2015 data to the data that we collected this last fall. And our newspaper number, the newspaper percentage for that category, do I get the majority of the information from the newspaper, is rapidly declining. So I think as a board, your most bang for your buck is to get good, accessible information out on social media, and these videos are a great way to do that, I think.
Yeah, I would, kind of lean towards the longer Facebook videos, especially then, we're not then additionally paying for ad spots. And I think that the longer conversations, especially the ones with the guidance counselors, I think that's an important piece for us to put into this because children are struggling so much. And I think that, we need to, as adults, be educated in what they're going through and how to help them. And if this is a way that we can do that, I think we should.
Pat, what do we do in your budget? We're gonna use the federal salary share for part of this, right? You remember specifically?
We actually use the CSP dollars for this one,
Okay.
but I do have some federal salary sharing dollars that we can use for this as well. And I think it's a good use of those. And I agree, when I think about the things that have been rising to the top most recently, children's mental health, huge, we've been tracking that, we've had some significant occurrences within our school districts. So by having that voice for the parents and the family that really are in a new world they don't even know about right now. And then the suicide aspect of this. Because that really, I think, is the most difficult area for people to seek, acknowledge, and go on before your life is just in the toilet. I think those are really three dialogues we really should try to encourage people to at least think about.
Anna does a terrific job in the other 3 videos that we have. I just want to note quick fast that she talks about the Lewis County Suicide Prevention, the Lewis County Postvention Team, and then also just the third video is more just about general mental health, because a lot of times suicide is the end, and it's preventable many steps before that. So we, again, didn't want to just focus on the suicide piece, because that's like trying to stop the dam from breaking when it's already crumbling. We want to try to give people the access to plugging the little holes when the leaks spring up. And she did just such a phenomenal job. It was hard to cut that down. Should have been a true 60 minutes, you know, piece, but,
We also, Anna is gonna share a few slides here before we wrap
Oh,
up this
great.
mental health conversation about the post-vention team, but before we move into that, how do you guys wanna proceed with this video project?
I think we put 5,000 out of Pat's budget, and I think that if we put another 5,000, that could go a long way.
I think it's money well spent. I mean, the first responder, and I've responded to 3 suicides in the past year. It's a real thing that happens out there, and I lost my son to suicide. I think, if we can save one life, it's well worth it.
Okay, so I'll work with Tyler, come up with a package that fits within, I didn't write down all those
I'll send it to you.
but, we'll find a package that works within that and we'll keep moving on it. Sounds like not so much towards the WWNY TV, more towards the social medias where folks are leaning then.
I do think maybe some, because I do think people do watch the local news and get it.
And I think there's some option, I don't know how you take that, but, you talk about the public service options are available, and they also have For Your Health. I mean, there's a couple
Yeah.
other segments that they do, which I don't think, we would just provide them with a clip or something.
Okay,
Oh,
point,
yeah.
Yeah, that would be
Yeah.
good. I think that when we did it last time, it was 30 and 60-second slots that they can create. And I think that, I don't remember what the budgetary piece of it was, but personally, I would recommend using John's video because he is the target demographic, statistically speaking. And we could very easily cut that into a very slick, especially if we got 60 seconds. If you're gonna do an ad, I'd say you try to get one 60-second ad that plays right to the core of the group that you're trying to go, that plays during sports, that plays during the news.
Nick, at Lincoln Lewis and WWNY were great. They gave us, 2 for 1 almost. Every ad slot we bought, they gave us a PSA slot for free. So we got a pretty good deal with that last time, the vaccinations and whatever. So,
I mean, is this a newsworthy item where we could, like, the news could broadcast that we've got this information out here? Where, there might be people that don't know about it, especially the older people. Don't know about social media as much, but if it was a news story that they watch on the news, they could link it to this and.
so like Pat was saying, the For Your Health segment that they do, this could be good. I know we'll get some free media today from the folks that are here. So.
Yeah, but you're not buying anything at the newspaper, we're going out of style.
Well, play some more videos.
There's a few out there, we'll get them.
I think we might have a way to at least to link onto the website a video or two, or put it on our social media for you as well, just double check that.
That's a very valid point, because I'll show my ignorance. I don't know how to run Facebook. If I go on Facebook, I see nothing. And here's all this stuff out there. I don't know how you get there.
So something that we did, that you'll see in the other videos is we built a QR code, which I'm sure most of you have seen now. It's just like a little square with a bunch of random plots in it. When you hold your camera up to it, it'll take you to a site. Something that we could potentially do with you guys in the newspaper is link that, just like that, so people can literally right there
Did
take
you
it right
have
to
one of
it.
them with the QR code?
Yeah. It's weird technology. But it's kind of cool. So.
All right, we'll continue to work and develop that. We've got a kind of a sketch of where you guys want to head next. In a few months, we can come back and kind of do another update. It's one of the things, that was a priority for this committee this year. So we'll circle back to that.
Thank you, Tyler, so much.
Thank you,
They were
guys.
phenomenal.
Yeah.
And then, I guess we'll have Anna. Come up.
There's the, yeah, there you go.
Anna, can I have your autograph?
If you want it. Not worth much.
Alrighty,
So you're getting a 2-for-1 from me today. I'm gonna update you briefly on the traumatic loss team, which I referenced in my video, and then I'll also give you the COVID update for Ashley today.
Oh, did you get a 3-for-1? Because you already got it.
Oh, that's
amazing, yeah.
Okay, so Lewis County Traumatic Loss Team. This is the county's post-vention team that I referenced in our video. It started in 2018. The Lewis County Suicide Prevention Coalition received funds from the state to develop a post-vention team. And if you're not familiar with the term, post-vention is an organized response in the aftermath of a suicide to accomplish any one or more of the following. So either to facilitate the healing of individuals from the grief and distress of suicide loss, or to mitigate other negative effects of exposure to suicide, to prevent suicide among people who are at high risk after exposure to suicide. So we know that when you lose someone to suicide, your risk for attempting or completing suicide goes up if you are in that person's circle. So this team was developed to respond to suicide losses, and it actually kind of serves as prevention too when you think about it. We use the term postvention is prevention because when you address the loss, your hope and help people go through what is ultimately the grieving process and navigating aspects of life after the loss, you're hopefully preventing future losses. We do have a number of suicides in our community each year, but we also recognize that there are other types of sudden or traumatic losses that occur in our community, and that whether it be an automobile or ATV, snowmobile accident, or any other sort of sudden or traumatic loss, those losses also have significant risk associated with them to the people in that circle. So we expanded the scope of our team to respond beyond suicide losses to other sudden or traumatic losses. So a little bit more about the team. We are a group of volunteers who are able and available to provide supportive services to different agencies, businesses, families, or individuals in Lewis County who have experienced either a suicide or other sudden or traumatic loss. We believe that individuals are resilient and that if they're offered support, interventions, or other information, most individuals affected by the loss can heal without formal counseling or interventions. Sometimes formal counseling or interventions are needed, in which case we are able to refer them to additional help or support. And again, I mentioned earlier the other types of losses we've responded to, either ATV, snowmobile, farming accidents, things like that. So how we work, we are typically notified and able to respond to a call within 24 to 72 hours of the incident. Sometimes there's additional follow-up, and that just depends on the circumstance, but a response is what we call us going out to either or connecting with the person to help them or the family. Can happen in person, over the phone, electronically, or through any combination of sorts. We are on call 7 days a week throughout the year. The community can call 376-9735 to invite a response. And how the process gets started is basically a conversation between the lost survivor and whoever on our team is on call for that week. And that's how we determine kind of the level of response that it's going to take. Each response is unique and individualized and very driven by the survivor. It really looks different every time. The responses we've had have all been a little bit different. Each response involves about 8 to 16 hours of behind-the-scenes work between initial discussions to coordinating with the team, coordinating the response, who's going to go out and meet with people to debriefing afterwards. And sometimes we do actually participate in follow-up debriefings with people. Up until a few months ago, to request a response from the team, the community was encouraged to call the hospital switchboard. We're so grateful for their help with that as we kind of navigated the waters of being a relatively new community resource, but Fortunately, our friends at County IT helped us find our own 376 number, and just again, hoping to take one less step out of the equation, make it as easy as possible for people to get the help they need. And again, the message at the bottom there should be reinforced. We do not provide therapy or clinical interventions. We can help people access those if they need it, but we believe most people can get through or on to the next day without those. Here's a little timeline of our work. So way back when in 2017, that feels like ages ago, we received initial funding from the New York State Office of Suicide Prevention to get this post-vention team started. We then had a facilitator of theirs come up to Lewis County to train interested community members. The training took about a year. We launched formally as the Lewis County Community Crisis Response Team in June of 2018. And then this winter, we rebranded to the Lewis County Traumatic Loss Team. We found, unfortunately, that the name Community Crisis Response Team was getting confused with the Behavioral Health and Wellness Crisis Line. And if you're not familiar with that line is for people currently in crisis, where we are trained to support people after a loss has occurred. So again, we want to make sure that people are getting the appropriate response and care that they need when they need it. But we have a great relationship with behavioral health. So if any issues have occurred, we've resolved them very smoothly. So we have 9 team members, about 90% of which are volunteer. I'm the only one who does some parts of this work as part of their job. We've received 27 calls to date, I guess through 2021, and have completed 16 activations. So we consider an activation to be when we go out to and respond to the business, the family, the individual, and we see the whole thing through. Sometimes people have called us and they were meant for behavioral health and wellness, or it wasn't an appropriate match, so we would refer them on. And of those 16, some have included follow-up meetings, but that number doesn't include those. We did a formal press conference when we launched. We have a website. We've had various informational meetings and presentations. I have business cards here if you'd like to take some and distribute them as you see fit. We have sent letters to large employers to let them know, like, especially if a loss occurs within a large institution, we're able to go to various employers and help facilitate a debriefing there. We have a Facebook page now, and what I think is been very valuable is we are trying to send an annual letter to our community partners. So we've received, anybody can request a response from the team, but we do have very valued community partners who have referred people to us. And this letter was designed with the hope to let people know without breaking confidentiality that some of their referrals we've been able to see them through. We've been able to support the people that they encourage to connect with us. Because again, we're a volunteer-based organization. We can't do it without other help. Here are, and I'm sorry, they're very, very little now that I see it. But these are just 2 quotes. We've responded to losses within school districts. And these are 2 quotes from school districts about our response and the support we were able to offer their school community. And as far as families are concerned, we've received nothing but positive feedback from them as well. I will add too, our team has been very successful, and that success is being recognized throughout the state. We've offered support and answered questions for other communities trying to develop a post-vention team. I presented at the New York State Suicide Prevention Conference a couple of years ago, and we continue to be a resource to communities who are looking to do this good, tough work, I call it.
Yeah, responded as well to continue to toot our own horn to Jefferson County a couple of times.
Yes, we have been able to offer them some help as well. The funding sources we've had have varied significantly. We had those initial funds that came in to get us off the ground. fortunately, again, so this team was developed as an offshoot of the Lewis County Suicide Prevention Coalition. And when the coalition does get occasional funds, they've actually allocated some to the team specifically, so we can purchase things like books about loss that we can leave with survivors, or we've had advertising spots. We bring tissues and journals and water to each response. We have a lanyard so people know who we are and why we're here. We send postcards as follow-up to each response, and then we have business cards we distribute also. But this year, the county has allocated $6,000 in your budget to our team. Thank you very much for that. Not used to having money, so that's exciting. But we've been very creative. We won't. We've been very creative and very efficient, but those funds are only going to help us hopefully increase our reach. We've had tremendous success, but unfortunately, I do know that there have been lost survivors who have either not been served or who have been underserved, and hopefully these funds can help us do what we do even better, get the word out more about this resource, and make sure that we're doing everything in the very best way that we can. And I do want to say a special thank you to these community partners. They have been instrumental in our success and referring survivors onto us. So we don't cold call people. So we may know about a loss in the community and want to call people, but we don't want to blindside anyone. So community partners like these, when they are responding to the loss or when they meet people along the way of their journey after the loss, they'll hand them one of these cards, explain the team to them, or they will ask the family, the business, whoever it may be, if they have their permission to share their contact information with us, and we will call them. It was really cool a loss that we received calls for. I actually got 3 referrals about the same loss from 3 different organizations. So we've come a long way and couldn't do it without them. You've helped us by including us in your budget this year, so thank you for that. But we also have a website and a Facebook page and business cards here. So if you'd be willing, really appreciate it if you could take some and share them, and I have plenty more. So don't hesitate to take as many as you need. But thank you very much for your time.
Thank you.
Thank you.
Thank you.
And I'm happy to answer any questions if you have them.
Do you respond teams, like 2 at a time? You know, just use a
Yes,
single word different, so that you are 2 or more when you respond to you.
yes, we have an internal rule that no one person responds alone, so 2 team members always go, at least. Sometimes if it's a larger group that we're facilitating a debriefing with, we'll send more than that.
And some of those cards maybe could go down to the field side.
Sure. Absolutely.
I guess, if there's no other questions, the COVID update then.
Sure. Alrighty. So switching gears to COVID, since our peak in the second week of January, when there were a total of 639 cases, we continued to trend downward. So that those 639 cases actually came January 8th through 14th. This month, February 8th through 14th, we had a total of 94 cases. So significant downward trend. I believe in the report Ashley submitted to you, there was an updated vaccine count, so you should have that. Our hospitalizations have remained pretty stable through this latest peak. I'm very happy to report that we had 11 yesterday, but we're down to 6 today, so that's very welcome news. But we did, and you will see it today, have 1 new death today. Other than that, not much else to report. Any questions?
Questions, Hannah?
So Lisa, Jerry contacted me this morning, and asked if he could provide a brief update regarding booster mandate and how that's going to impact their organization. It's a fluid situation and it's changing all the time, so we didn't get it on the agenda. But if you're okay with giving
Yes,
our hospital
please.
CEO a few minutes here. Jerry? Check your notes.
Thank
Go.
you. No problem. Sure.
Which one is it, Ryan?
It might be the first one, DOL, HHS.
So you have.
I also have the 2004 highlights of the ALCS, if any of you are interested. Which game was
We've
that?
suddenly run out of time.
I actually have.
I just couldn't help myself on that one. All right, good afternoon, and thank you, Lisa, and appreciate being able to give you an update on something that is nearly taking 100% of my time. I want to talk about the impact of the mandated booster vaccination. So I think this can complement what Anna was sharing with you earlier. So this is what I look at every single day, and I share with the members of the senior management team in the health system. This is real-time positive tests over time for Lewis County. So what's relevant? You don't need to know the numbers specifically. The orange line reflects the case count for 100,000, and it's in alignment with what you just heard. You can see there's a steady decrease in that orange line. What I find intriguing is, okay, so right there, if you just take that line and go across, you can see it reflects what transmission was looking like back in May of 2021. And what that tells us in the health system is that there is still active transmission going on. And then what does that mean for us? It means that we have both patients in the hospital and in the nursing home. And today we have 5 staff in isolation. Last time I met with the board, I shared that in January we had 16 days where we went on ambulance diversion. We've had 2 such days in the month of February. So, we clearly as a community, as a county, we're making headway. However, there's tremendous stress on the providers of health services. And that stress presents itself both in numbers of patients receiving services and the number of staff available to deliver those services. Every morning I share, the first thing I do when I come in is build this matrix. So this is what it was like this morning. Lewis County's positivity rate for yesterday was 9.2%, North Country 8.1%, and New York State 3%. So what's important here is every single data point in that column has the word up. It is up higher than it was the day before. Now, a single day doesn't make or break a trend, so we look at 7-day rolling average. And for Lewis County, it's 6.8%, and it's up. We have 32.9 cases per 100,000. And then you can read the rest. In the upper right-hand quadrant, you look at vaccination percentage. So this data is as of yesterday at 11 o'clock. 51.3% of our community members were fully vaccinated. Now, there are 2 standards for fully vaccinated. There are people who do not work in Article 28 organizations. The health system is in Article 28. We need 3 vaccinations. For the rest of our community, you are fully vaccinated if you have 2 doses. So COVID continues to stress the health system. We have 4 community members in our beds right now. We have 5 staff members in isolation. And, I reviewed ambulance diversion data with you. We are working with both Haney's, the Hospital Association of New York State, and IHA, which is the Iroquois Health Association. This is data that was gathered on Friday, the 11th, and it was shared with us Monday or Tuesday of this week. There are 37 facilities in central New York, which incorporates the 7 counties of the North Country. 27,308 non-boosted employees represented by those 37 facilities, out of 75,515 total employees. So what this translates to is 37% of the employees are not boosted. This is a big deal because by next Monday, the 21st, we all need to be boosted. And 100% of healthcare organizations, Lewis County Health System included, are offering regular vaccination clinics to get staff boosted. So these represent all positions. And on top of that, hospitals represented, the 37 hospitals, we have 16,600 vacancies. That's an 18.2% vacancy rate compared to 14.3% 1 year ago. So it's a 27% increase. Registered nurses are a real challenge. So this data represents 36 facilities. And what it's doing is excluding long-term care, just looking at acute. There are over 12,000 RNs employed as of 1/1. It's the largest category of employees in a hospital, which makes sense. Right now, there are 4,167 RN vacancies out of those 37 facilities in central New York and the North Country. So this just shows you a trend line over time. The red line reflects registered nurses. So a quarter of nursing positions are vacant, and 18% for the entire staff. And this is just to give you a sense. So what matters here to me, licensed practical nurses and CNAs. We do run a large facility, and emergency room nurses. So I want to bring it to you locally now. As of 8:30 this morning, we had 609 members in our organizational count, and that's made up of employees. The PLLC, we have a limited liability company that employs the physicians. Contracted staff, so an example of a contracted staff member would be the fellow who takes care of biomedical devices for us, and he works for one of the larger national groups, and the board of managers. Out of the 609, 410 have received their COVID vaccination. So, that's good effort by many to jump in. We have 199 members of the organization who have not been boosted yet. So the 199 we have to break up into 2 buckets. There's a 5-month window from when you received your second shot to receiving your booster. So 130 of the 199, the booster will be required sometime between February 22nd and June of 2022. There are 69 staff members right now who must receive the booster by Monday. And tomorrow, we're having a full court press on this, trying to figure out how we're going to get all 69 in. The other important part of the next level of work is to figure out their discipline and which department they're associated with. To date, because of the mandates, we have lost 49 members of the organization. They have either resigned or they've been terminated because they didn't meet the deadline and they couldn't work. And they wouldn't tell us what they would do, so we had no choice but to terminate. 49 members, when you have a workforce of 600 people, is a big number. And embedded in that number is the reason our maternity service is on pause. So it was important to share this with you. I also wanted to share with you that I have written to both Haney's and Iroquois, and Haney's, after receiving my communication, asked if they could forward it to the second floor in Albany, so, the governor's staff.
Not the second floor.
Not the second floor here, because I know, well, I'll leave it there. So that, all I did was provide data with regards to how one hospital would be impacted, very similar to the information I just provided with you. We also have received a letter in which we've been asked to co-sign as CEOs. The letter is made up of CEOs who are part of the Iroquois Health Association, and I sit on that board. And it's to support the efforts of Iroquois in communicating to the administration the real challenge that lies before us. We already have paused maternity. We've had 16 days of diversion in January, 2 in February, and tomorrow we're going to figure out which other services will be at risk. I mean, and at the end of the day, nurses for hospitals and CNAs and LPNs, they are the largest part of your workforce. So I'm not the only CEO talking to their boards, and you're one of 2 boards that I engage with and report to. And this is a serious matter. And now I would open it up to any questions that you might have.
I just want to start off by saying that the vaccines, the booster, they are safe and they are effective. That being said, I have talked to colleagues who will leave their profession over the booster. I think this is really hitting a different nerve than even the original mandate. So my question is, you have added your name to this?
Yes, sir.
Okay, and from talking to Iroquois and Haney's, do you think anything will change?
I truly don't know. Normally I have a leaning. Contrary to what some of you might think, I really am not good at politics and don't fully appreciate it, right? In the way that you do. And when I say appreciate it, the nuances associated with politics. Frankly, I'm not very good at it. And, sharing information with this body back in, it was either August or September, about the maternity service was very difficult. And it became clear that politically I misstepped. And so I truly don't know. I know a lot of people are working hard through Haney's, Iroquois, individual organizations, as we are, really expressing there is a level of vaccination fatigue among our community members. And I think the Omicron really has escalated it. If the response is every time there's a new variant, there's a new booster, we will have no one working in healthcare. And that's how people are feeling, and that's what they're expressing. So what do I think we need to do? I think we need to do what we are doing now. We have been very good, as all hospitals have, in not having spread within their organizations. That's because we wear these things all the time. However, I just told you we had 5 members who are in isolation. How does that happen? It happens because once they leave work, they don't wear their mask. They go to places, they do things. I'm not judging that. That's life. So if we're going to use mandated boosters to keep people safer, vaccinations do a great job of keeping us alive if we become ill. It is not going to guarantee you will not get the virus. So it does a great job. And those who have not been vaccinated, that data is very clear. You got a good chance of not making it. So I think what we need to do is continue to reassure we're following all of the protocols, keep staff and community members safe when they come into our institutions. And then when people go home at night, we gotta let them live their lives. I've never once endorsed a mask mandate for home. Now, it sounds silly, right? I clearly feel we need to do it in larger settings, as you all know. But once you get home, it's different.
Does anyone else have any questions for Jeremy?
Jerry, you and I haven't had a chance to talk too much about this, but has NISAC engaged at all with Haney's on this issue?
I don't know.
Maybe that's something that we can look into this afternoon at some point. See if they're, if this conversation is happening, a similar conversation is happening across, the Iroquois network, which is huge, that involves a lot of counties. Maybe that, they could be another ally.
So I wanted to update you on what's happening locally. And two, by speaking with you today, it allows me the opportunity to go on record and share with you what we're doing and what our current challenge is. And as always, if you have any questions after you reflect, you know how to get a hold of me. Alrighty, thank you.
I think you're doing, all that you can, so.
No, thank you.
Appreciate it. Presentations. Next up is Ryan, discussion on social services education plan.
Sure. So when we first set out this agenda, this was going to be a much different discussion. But I will update you all as I have done via email the last couple days. Without getting too much into specifics at this time, because we are going to have an executive session to talk about this. But I do think that we have found a potential home for social services and not just social services, for Office for the Aging and Pat's department, although she can go just about anywhere. During the renovation project, I think I think we're pretty close to having a solution figured out. But I think Joan wants to go over some specifics of that in executive session. We probably will need to make a motion today, but we'll wait until after you guys have had a chance to be briefed by the county attorney. So I'll leave it at that.
Is Jenny happy with proposed?
Yes, but I would say time is of the essence. We're already behind the timeline.
Okay.
To try to get our circuits and our network.
Okay.
We're already late.
Perfect. Thank you. Okay, I guess we can finally move on to dockets.
Okay, appropriating funds in the Public Health Department in the amount of $1 million from New York State grant for continued pandemic response.
Any discussion? All in favor, aye. Opposed, nay. Carried.
Authorizing agreement between Jefferson Lewis BOCES and Lewis County Public Health Agency for reimbursement of staff time engaged in COVID screening and testing in schools.
Discussion?
I have a question. Does this involve, like, West Leiden School, which is in Lewis County? Is West Leiden School covered with that, or does that go to?
Yes. Partially. They've been, they're part of the Lewis BOCES, right? So their kids come up to our BOCES. So, Anna, do you know specifically what we're doing with West Leiden?
I don't offhand, but they're part of BOCES.
They've been part of all of our many calls that we've had with all the school superintendents in Lewis County. Ironic has always participated with us. I do think that they were eligible for this for the West Leiden Elementary School. But each county in the state was given money to assist the schools with testing. Some counties chose to do an individual contract with each school district. We, I think, smartly chose to do one contract with BOCES, and then they can kind of sort out which school's getting one. So
Thank you. I was just wondering how Adirondack was that.
it's strange because it's literally just the one elementary school that is eligible, but also they have Lewis County residents that go to the high school, the middle school in Boonville. They've been eligible for services as well. So Harrisville and Adirondack have been the two that have been tough.
Thank you.
Any other discussion? All in favor, aye.
Aye.
Opposed, nay.
Carried. Appointing members Lisa Peebles and Cassie Forbes to the Lewis County Youth Bureau Advisory Board. Discussion? All in favor, aye.
Aye.
Opposed, nay. Carried. Appointing student representative Isaac Gibson of South Lewis Central School to the Lewis County Youth Bureau Advisory Board. Discussion? All in favor, aye.
Aye.
Opposed, nay. Appropriating funds in the Workforce Innovation and Opportunity Act accounts in the amount of $25,000 for adult and dislocated worker programs. Discussion? All in favor, aye.
Aye.
Opposed, nay. Carried. The first motion is to authorize Public Health Director Ashley Waite to refill one full-time administrative assistant position effective immediately. I'll make that motion if I could get a second.
Second.
I would add that, we have had staff losses as well because public health is a health institution. So this position is due to somebody not willing to get the booster.
But it's a funded position, huh?
Yeah.
Any other discussion? All in favor, aye.
Aye.
Opposed, nay. Carries. Motion to authorize Social Services Commissioner Jennifer Jones to refill one full-time case aide position effective immediately. I'll make that motion if I can get a second.
Second.
Discussion?
Is this funded, Jenny?
Yes.
Thank you.
All in favor, aye.
Aye.
Opposed, nay. Carried. If no one has anything else, I just want to say, we've recently heard of a county employee who is not doing so well in the hospital. And I'd like to just take a moment of thoughtful reflection and prayer, just to send all of our well wishes to them. Thank you. That is it for me.
Executive session.
You want to do executive session now?
We're gonna do all the sessions at the end, if that's all right.
If I can get a motion to adjourn. Second. Adjourn, thank you.